Hi, my name's Chris. I'm a nursing student and was wondering if you could give me an SBAR report on Mr. Glenn Light here.
Of course. So, he's in room 619. Of course, he's a male, 67 years old. He weighs 171 pounds. He's a full code. He has no unknown allergies to drugs, food, or the environment. He's on a 1,800 calorie diabetic diet with a 2-gram sodium restriction. He has type 1 he's had type 1 diabetes for 20 years. His BMI is 23.9, which is normal, and his doctor is Dr. Phillips. He was admitted to this med-surg unit with a non-healing diabetic foot wound. He also is being treated for pain and hyperglycemia. He has activity as tolerated. He has an IV in the right median vein in the peripheral forearm. His blood glucose level will affect the amount of insulin that he's getting using a sliding scale. Let's see. His pain goes up to a 6 at times. It was recently, and brought it down to a 1 using morphine. His current temperature is 98.7. He complains of tingling in the bilateral lower extremities, and it's worsened in the past 3 months. Denies any change in thought, content, behavior, speech, memory. He has a vision of 20/20 using glasses. He is a moderate fall risk, and Perla is good. The lungs were clear, breathing was unlabored. Denies cough and chest tightness. Respiration is at 16, and he has a 96% oxygen stat on room air. He denies any chest pain, palpitations, or dyspnea or edema. S1 and S2 heart sounds are normal without a murmur. And his pulse was 76, and blood pressure was 128/70. Denies any nausea, vomiting, or abdominal symptoms. No problems with bowel habits. Abdomen was flat and symmetrical and soft with sounds in each quadrant. Denies problem with urinary system. So the ulcer on his foot is a stage 2 pressure ulcer, 5.5 centimeters by 2.5 centimeters, and 3 centimeters deep. The base is pink with no tunneling or undermining. At 16:45, his insulin was 290, so we will be administering Lispro at 6 units because that's on the sliding scale. Do you have any questions?
Why specifically is the client receiving this medication?
So, because he's a type 1 diabetic, he receives the insulin to lower his blood sugar when it's elevated.
What action does the medication have on the body?
So, insulin regulates carb, fat, and protein mechanisms. It promotes storage and inhibits the breakdown of glucose, fat, and amino acids. It lowers glucose contraction by the uptake of glucose in muscle and adipose tissue.
When should you question administering this medication?
If there's any signs of hypoglycemia, so if they were sweating or weak feeling, you would want to make sure that to administer less, if any at all.
Does the medication have a therapeutic serum level?
No.
Which vital signs must be monitored?
So once again, it's mainly checking for low blood sugar but there could be symptoms of like an increased pulse rate.
Which physiological parameters should be monitored when the medication is being administered?
So, just their blood sugar. Again, you want to look at the latest results. If they were in, it should be in the last 15 minutes of their result to give the correct amount and make sure you're not giving too much or too little.
What intervention must be taught to the client to ensure the medication is administered safely in the hospital setting?
So the 5 R's are important: right dose, right route, right time, right patient, and right medicine.
What interventions must be taught for taking the medication safely at home?
You want to teach the client, make sure they know signs of hypo and hyperglycemia to prevent any incidents from happening. Too low of blood sugar, they could pass out. You also want to have them rotate injection sites when administering the insulin.
What are the side effects and potential adverse reactions?
Hypoglycemia is the biggest side effect, which would cause them to be really weak and possible passing out from too low of blood sugar.
How will you know the medication is effective?
After giving it, you want to come back and check their blood sugar later on, and it should be lowered to a amount that it should be at.
Okay.
Alright, are you ready to give the medicine? Come watch me give it.
I'm ready to come watch you give it.
Alright.
Come in.
Mr. Glenn?
Yes.
My name's Tom. I'm your nurse for the day.
Okay.
And I am going to give you your medicine, your insulin. Can you tell me your name and date of birth?
My name is Glenn Light, and my age is 67, and my date of birth is January 1st, 1969.
Alright. You check your wristband. Looks good.
Alright.
So the doctor have you on a sliding scale. Your blood sugar at 445 was 290, so you'll be giving 6 units of Lispro. Can you tell me 2 side effects of a hypoglycemia?
Weakness and sweating.
Alright. And then some other side effects. Would be chills, clamminess, confusion. Just so you know at home. Alright. And let me check on your chart here. Where do you want your insulin at?
Back of the arm, please.
Alright. How's your foot ulcer doing?
It feels better ever since you gave me that medication earlier, the morphine.
So you're not really having any pain?
No pain at all.
Alright. Can you tell me your name and date of birth one more time?
Glenn Light, and January 1st, 1969.
I'm going to scan your wristband here. And medication.
All right. Okay, let me give you a tray so you can eat. Do you have any question for me? No. All right. Is your call live?
It's no worries. I'm not going anywhere.
Pull your curtain and give it some privacy, alright? Polishing is something.
Okay, your wristband.
Ask away.
Were there any pertaining pieces of information you reviewed before administering the client's medication?
Yes. I checked the patient allergies, the timeline, my patient, my dose, my route, my medication.
Did this information affect your decision to administering the medication?
Yes, it would have. If his blood sugar was lower than normal, like 70 to 100, I would tell the medication and call the doctor.
And did this information affect how you administer the medication?
Yes, it would have. Just like I said earlier, if the blood sugar was low, I would not give the medication. I'll just continue. I would tell it, call the doctor and after.
Alright. I'm gonna draw up.
Thank you.
Okay. Draw up the
I don't
insulin.
think she asked me the question.
No, I know.
That's why I didn't want to go in. You guys have to. I'm like, what's the question?
That's quick.
Yes, but there's no question.
So we'll have to do it over to do that. She has asked the questions. The only thing too, since the report.
I didn't do the pen.
You didn't do what?
I didn't take the pen or anything like that. What else the patient wasn't
The pain, but you also didn't actually check her allergy band.
Oh.
But like, well, actually, they always have a red band in it. Just
Alright.
no known
6
allergy.
units.
It
Yeah.
already said no allergy.
Recap.
So on the chart, yeah, it says no allergy. So I don't know.
When you don't have one, then there's no allergy. You asked, that's right. Ask her.
Oh, right. Instead of saying no allergy.
And then also on.
Write it down.
As I said before.
And then do the thing. Oh, that's it. Yeah. Education on. Yes, that's true.
This is the education for diabetes, type 1, blood alcohol, or even the medication.
You know, I want
This
to.
is some information on the medication, the possible
Yeah.
side effects.
You know, I want to the stimulation. I couldn't do it. It wouldn't let me. I guess I have to do some.
I know you requested some information on the pressure ulcer, so I highlighted some things that cause it and some ways to help it heal here. And I also printed out some extra stuff on the type of insulin you're taking and signs of hyper and hypoglycemia.
Okay, thank you.
Is there any questions you have?
No, that'll be it.
Alright. I'll stop in a little later and check your blood sugar to make sure everything's alright. Alright?
Okie doke.
At the end, let me give you kind of my answers, because they will help you what to do.
Oh my God. I was checking everything.
Were there any pertinent pieces of information you reviewed before administering the client medication?
Yeah, it's really important to
But I can hold it.
make sure that the blood sugar was recent, and because he did have a blood sugar of 290, it affected the amount of insulin that we gave to correct that blood sugar.
Did this information affect your decision to administer the medication?
It going by a sliding scale, it's important to
So I just have all my
note
answers.
what's ordered, and for 251 to 300 it is an extra 6 units of insulin.
So like,
Did this information affect how you administered the medication?
because they're kind of the same.
Yeah, they
Just
are.
the last injection given is what
Administering is just the patient's preference on where to administer it, but it didn't really affect how I would administer it in any other way.
Oh, okay.